my name is Cynthia. I'll be your nurse today. What is your first and last name?
I.E. Mosley,
What's your date of birth?
born 18-2000.
Okay. Today I'm going to be doing a health assessment of your abdomen area, which means assessment means I'm just looking at it, checking it out, listening to your stomach area. That's your abdomen area. At any point, if you feel any pain or discomfort, I want you to tell me. Is that okay?
Okay.
Is it okay if I check out your stomach area and listen to some box sounds? Okay. First, I have a few questions for you. Have you had a decrease or increase in your appetite recently?
No.
Okay. In the last couple of weeks, have you had any constipation or diarrhea?
No.
Okay, very good. So first thing I'm going to do is pull up your shirt. Is that okay? All right. And I'm going to pull down your pants to expose your abdomen. Okay. Let me know if you have any pain or discomfort when I'm touching or looking, okay? So first thing I'm looking at is the contour of your stomach. It is uniformly round, which is a good thing. And umbilicus is sunken, which is a normal finding when you have a round abdomen, a round stomach. Now what I'm going to do now is take this pen light and I'm just going to shine it across the midline of your stomach. And while I'm doing that, I'm just kind of looking for lumps or masses, anything sticking up that shouldn't be there. And I'm looking also at your umbilicus. Your umbilicus is midline, which is normal. And I'm also going to look, I don't know, the hernia or anything around it, any masses around it. No discoloration noted, no inflammation noted, clean and dry. And it is the midline. Also, your symmetry, you have bilateral symmetry, which is good. Looking at the color and the tone, you have a even tone, smooth skin, and no scars or open wounds noted. You do have a few striae, which are really just stretch marks, and I see they are pink, which means they are newly formed stretch marks. Sometimes when we eat too much or we grow, we get stretch marks, so that is a normal finding. Also, while I'm there looking, I'm looking at your aortic pulse, which is up here. It is at the upper gastric area, below the diaphragm, midline slightly to the left. I'm looking for a pulsation, which I see a slight one. Also, I'm looking for your peristalsis, which is just a smooth wave or kind of smooth slight motion with your stomach, which I noticed, which means your peristalsis, which means everything in there in your abdomen is moving the way it should, which is a normal finding, okay? So that's good. Normalities noted so far. Now, if you took your stomach and you split it evenly, like a tic-tac board, you would have 4 quadrants, and you'll hear me refer to those. It is your right upper, which is your right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. So you'll hear me kind of say that off and on, okay? So first thing I'm going to do is listen, which is called auscultate. I'm going to take the stethoscope, and I will listen for 15 seconds in each quadrant, and there's 4 quadrants. So I'm listening for vowel sounds. Okay. Vowel sounds are active in all 4 quadrants, which is a normal finding. No abnormalities noted. Next, I'm going to listen for vascular sounds, which are buries, or things like that. You have arteries in your abdomen area, and I'm going to use the bell of my stethoscope because they have a pitch to them, okay? You have an aortic artery, renal artery, iliac arteries, and you have femoral arteries, okay? So I'm going to listen. Let me know if you feel any pain or discomfort, okay? Aortic, which is slightly midline, upper gastric area. Renal. Iliac artery. One is on both sides. You only have one aortic. And femoral artery. Okay. No bruit noted. No abnormality sounds noted in the vascular sounds assessment. Next we're going to do is called percussion, which is kind of a tap. And what I'm checking for is Tiffany, which is just, I'm kind of feeling for vibration, the hollowness of your organs. We're checking for like trapped air, will give me a different vibration, or any fluid that was in the wrong place will give me a different type of vibration, okay? So I'm going to do a tap, and all the quadrants kind of go in a zigzag motion. Let me know if you feel any discomfort, okay? So I'm going to do a tap. Tiffany noted in all quadrants, which is a good thing. No abnormalities noted. Next thing we're going to do is your CVA tenderness. For that test, I'm going to need you to sit up because we're going to check the kidneys, your flank area. We're checking for kidney inflammation, or it could be a sign you have a kidney infection, okay? So I'm going to help you sit up on the bed. Okay, sit straight up for me. Okay. Having any dizziness or discomfort?
No.
Okay, I'm going to take my hand and put it over your, you have a right and a left kidney. Everybody has two kidneys. I'm putting it over this kidney. And what I'm going to do, you're going to feel like a thud. What I'm doing is a fist percussion, okay? Let me know if you feel any pain. Any pain or discomfort?
No.
Okay, I'm going to do the same thing on this area. Any pain or discomfort?
No.
Okay, no CVA tenderness noted. Okay, I'm going to help you lay back down. Very good. Next thing we're going to do is some palpations. First thing we're going to do is a light palpation. What I'm going to do, I'm going to take my fingers and just press about 1 centimeter in a circular motion, just feeling for anything that's poking up, sticking, any organs that might be inflamed or kind of out of place, okay? Starting at the lower quadrant, circular motion. And I'm just checking each quadrant. Only on 1 centimeter. Okay. Any pain or discomfort noted?
No.
Okay. Now we're going to do a deep palpation. I'm going to press a little bit deeper, okay? I'm going 5 to 8 centimeters. Circular motion. I feel organs. You feel any pain when I'm pressing deeper? Okay. No pain or tenderness noted in any of the 4 quadrants. Organs felt, no sticking up or movement of abnormalities noted. Next, we're going to check your organs. We're going to check for placement or just discomfort in the liver, spleen, kidney, and the aortic, okay? So first thing we're going to check is your liver. So I'm going to move your arm slightly. Your liver is over, right underneath your costal margin, the end of your diaphragm. And I'm going to take my hand and put it underneath your left and 12th rib cage. I'm going to help you lift up just a little bit. And I want you to take a deep breath, okay? Deep breath. Okay. Any pain noted?
No.
Okay. Ridge of the liver noted. No abnormalities noted. No movement noted no movements noted on inhalation, exhalation. Next, we're going to check your spleen. So I'm going to do the same thing. Come over to the 11th and 12th rib. Your spleen is on your left upper quadrant. And what I'm going to do, I'm going to take my fingers and point them towards your axillary, which is under your arm. And I'm just going to press down. Any pain noted?
No.
Okay, very good. The spleen was not palpated, which is normal because the spleen usually is not able to be palpated or felt unless it's 3 times its normal size, which would mean it would be inflamed. Okay, next we're going to check your liver. Next we're going to check your kidneys. You have kidneys on both sides of your flank area. On this side, on your right side, I'm going to do like a duck bill. I'll put one underneath the flank area and one here. I'm going to palpate. Kidney not palpated, but no movement noted. So that's a good thing. I'll do the same thing on this side, or this area, and palpate. No extra movement noted. Kidney not able to be palpated, but no extra movement noted. Okay, next I'm going to check your aortic. We've already checked it a couple times for pulsations and things like that, so that's what we're doing this time. And remember, it's the upper gastric midline, slightly to the left. I'm going to take these two fingers and place there, and I just want you to breathe for me, okay? Breathe. Okay, now just breathe normally. Okay. My fingers did not move, spread apart with breathing. That is a good thing because if my fingers had spread apart, it could mean an aortic aneurysm, which was not noted. Next thing we're going to do a couple of tests. We save this for last because it could be painful or discomfort while we're doing our assessment, so we save this for last. At any point you feel any pain or discomfort, let me know, okay? Okay, the first test we're going to do is the Murphy, and it is checking for liver or gallbladder inflammation, okay? So what I'm going to do is come to the coastal edge again, where your liver is, and just kind of palpate. Take a deep breath for me, in and out. Very good. No pain noted, because if the patient was having pain while she was taking a breath in and out, she would have hesitated with her breathing, and she probably would have jumped back with pain, but no discomfort was noted, so that is a negative sign, a good thing. The next one is the Bloomberg test, just checking for rebound tenderness in the abdomen. So I'm just going to press down and pull back. Any pain noted?
No.
Okay, very good. No abdomen tenderness or pain noted. Next thing we're going to do is the Rosking test, which is checking for referred pain in the appendix area. The appendix is the right lower quadrant, but we're going to check the left lower quadrant for pain. So same thing, I'm going to do a push and bounce back. Did you feel any pain in the right?
No.
Very good. No pain in this area noted. Next thing we're going to do is the leg test. This is called the Ilipovsky test. And what it's doing is checking for, again, for referred pain in the right quadrant area where your appendix is, okay? So I'm going to lift your right leg. Let me know if you feel any pain or discomfort. And while I'm lifting it, I'm going to push down on your anterior thigh. Let me know, while I'm pushing down, I want you to push back, okay? On 3. 1, 2, 3. Okay, very good. Any pain noted in the right quadrant appendix area?
No.
Okay, very good. Negative. All test findings were negative. This concludes the health assessment of Ivy Mosley, 21-year-old in the hospital for upper respiratory infection. The health assessment was done of her abdomen. Normal bowel sounds noted. No vascular sounds noted. Organs assessed. All organs appear all with Tiffany. No abnormalities found. No abdomen tenderness noted. This concludes our health assessment.